Hello everyone, my name is Adil Sharifat and this is the Advanced Online Coping Therapy course. In this video, we will discuss various methods to determine the appropriate placement of cups for coping therapy. So let us explore different techniques together. I hope you find this information helpful. If you're ready, let's begin. So the first method is based on cupping examination. In cupping examination, there are three separate cupping areas: the back, the head, and the feet. The front part of the body does not fall under the cupping examination area except for specific points used in treating certain diseases. For example, conditions like asthma, panic attacks, and high blood pressure may require cupping on specific points, such as the location of the thalamus and glands. The second method involves determining the cupping point based on soreness. For example, if a patient experiences shoulder pain, cupping can be performed on the shoulder area. Similarly, for back pain, cupping can be done on the waist. Muscle strains and fibromyalgia. I hope I got that spelling right. Well, it means muscle pain and tenderness. Don't go biting your teeth. Alright, so muscle pain and tenderness can be addressed by focusing on the approximate location of the pain. The third method is to select cupping points based on the patient's history form. You might recall the list of the 40 diseases in the patient's medical history form, including the condition most responsive to cupping therapy. If a patient informs us about the diagnosed disease and the associated organs, we can apply cupping to the corresponding area. For instance, if a patient mentions kidney problem, then cupping can be performed around the kidney. Likewise, if there is a liver issue, cupping can be done around the liver. The fourth point involves locating cupping point according to the autonomic nervous system, which is highly beneficial for targeting diseased organs. Let us delve into some anatomy information. The spine comprises of different groups of vertebrae, extends from the back of the neck to the buttocks. Extending from the back of the neck to the buttocks. The sympathetic and parasympathetic nerves passes through these vertebrae. These vertebrae resembling the shape of the letter S when viewed from the side. The vertebrae are divided into 5 groups. We have the cervical, we have the thoracic, we have the lumbar, we have the sacral, and we have the coccygeal. By understanding the connection between these specific nerves and organs, cupping points can be easily selected. For example, if a patient complains of eye discomfort, there are nerves that you can trace the nerves that are connected to the eyes and cup that part. And for lung issues, the lung nerves are connected. You can just trace the nerves connected to the lungs, and the heart share the same nerves. The lung and the heart share the same nerves. By understanding the connection between specific nerves and organs, cupping points can be easily selected. It is important to ensure that patients with vertebral problems such as herniated disc or ankylosing spondylitis do not receive cupping directly on the spine. Instead, cupping can be applied on the left and right side of the spine. Moving to the fifth method, we explore traditional diagnostic techniques used before the advent of medical devices like tomography machines and the likes. Doctors would rely on visual examinations of the patient's tongue, eyes, and finger. Apart from the tongue, eye, and finger, pulse diagnosis played a significant role. In fact, some doctors still use that till date. So they all play a significant role in identifying the patient's weakest organ. Once a problem is detected, cupping cups can be applied around the corresponding organs. So the sixth method involves selecting cupping points based on acupuncture. Acupuncture is a well-known technique, while mama points are derived from Indian. Although I haven't personally applied cupping using mama points or acupuncture, they offer another avenue to explore the field of cupping therapy. I hope you find these methods helpful in determining cupping points. And remember, traditional examination techniques requires specific training, but they can be mastered with practice. So let us continue our journey through the course. See you in the next video.